When you feel chest pain, do you catch yourself saying, "It's probably nothing serious"? But what if that discomfort is actually a critical warning sign that could be life-threatening? Is it really okay to convince yourself everything is fine? Missing an SOS from your heart could lead to irreversible consequences. That's why, through this video, I want to share knowledge about how to determine if chest pain might be an early symptom of angina or heart attack. I believe that knowing this information can save lives. What would happen to your body if that chest pain was actually angina or a heart attack, and you just brushed it off thinking it's probably fine? Just thinking about it makes you anxious, doesn't it? In fact, when angina or a heart attack occurs, some alarming processes are happening inside your body. With angina, the heart's blood vessels, known as coronary arteries, temporarily narrow, preventing sufficient blood from reaching the heart muscle. This causes chest tightness and shortness of breath, but symptoms usually subside within 5 to 15 minutes. However, don't be relieved just because it happens to go away. It's more likely to occur during exercise or physical exertion, and it can be a precursor to a heart attack. Meanwhile, when a heart attack occurs, the situation becomes even more serious. The coronary arteries become completely blocked, totally stopping blood flow to the heart muscle. Shockingly, heart muscle cells begin to die just 20 minutes after blood flow stops. Severe chest pain lasting over 30 minutes, cold sweats, nausea. These are typical signs of a heart attack. And once heart muscle dies, the heart's pumping function severely decreases, potentially leading to heart failure, life-threatening arrhythmias, or even shock. Without proper treatment, it can directly threaten your life. Early detection and treatment are key, particularly with heart attacks. Treatment within 6 hours of onset can mean the difference between life and death. Even with angina, you can't let your guard down. By seeking medical attention early, you can protect your precious life. So, if you feel any concerning chest pain, please value your body enough to take immediate action. Don't miss these potentially life-threatening signs. I'll explain the characteristics of chest pain that might indicate angina or a heart attack. Please watch until the end and use this important information to help yourself and those around you. And if you find this video helpful, please subscribe to our channel and hit the like button. We'll continue to bring you information to protect your health next time. First, let's talk about pain that appears in the center or left side of your chest. Are you ignoring that tight, squeezing feeling in your chest, thinking it's just fatigue or stress? But actually, this pain occurs when your heart isn't receiving enough blood. When the coronary arteries that nourish your heart narrow, your heart becomes oxygen deprived, causing a squeezing or pressing pain. This is your body's way of sending out a survival signal. If you ignore it, you might come to regret it one day. Your heart is working desperately to keep your body alive. Are you possibly missing signs that your heart might be crying out, "I'm at my limit"? Next, let's talk about when you can't precisely point to where the pain is located. With muscle pain or stomach pain, you can usually point exactly to where it hurts, right? But pain from the heart typically has a vague spreading quality. Since heart pain is felt through nerves, it's often difficult to pinpoint with your finger. Don't dismiss this kind of ambiguous pain. It might indicate that your heart is in a dangerous state. Pain that you can't clearly explain. That might be the very risk that determines life or death. Don't take it lightly. Then there's chest pain that radiates to your left arm, neck, jaw, or throat. Heart pain can spread to other areas through nerve pathways. For example, pain from the heart spreads to the left arm because they share the same nerve pathways. When you experience this kind of radiating pain, it's likely more than just muscle pain or body fatigue. Pain that resonates throughout your body. Ignoring it could lead to serious consequences. What would you do if that pain was a warning sign of danger? Understanding the difference between angina and heart attack can be key to saving your life. Angina occurs when the heart temporarily lacks blood, and the pain usually subsides within 5 to 10 minutes. It typically worsens with exercise or stress and improves with rest. However, a heart attack is different. It occurs when blood flow to the heart is completely blocked. The pain often lasts more than 30 minutes and doesn't improve with rest. Understanding this difference could lead to early treatment and might save your life. Are you feeling reassured just because the pain is temporary? That might actually be a warning sign of a life-threatening attack next time. Finally, let's talk about symptoms that accompany chest pain. Cold sweats, Nausea, shortness of breath, and heart palpitations often occur when your heart is in a dangerous state. With unstable angina or vasospastic angina, symptoms can appear with minimal exertion or even while resting. If you ignore these signs, symptoms could suddenly worsen and become life-threatening. Are you properly noticing the SOS signals your body is sending? Let's take action before ignoring them leads to irreversible consequences. Thank you everyone for watching today's video. We've explained the characteristics of chest pain that might indicate angina or a heart attack. Let's review what we covered today. First, there's the squeezing or pressing pain in the center or left side of your chest. This pain might be a dangerous sign that your heart isn't getting enough oxygen. Second, when chest pain is vague and can't be precisely pointed to with a finger, this might not just be fatigue or stress, but a warning sign of danger to your life. Then there's pain that spreads to your left arm, neck, jaw, or throat. This kind of radiating pain might indicate your heart is in serious crisis. Next, the difference between angina and heart attack. While angina is usually temporary and improves with rest, a heart attack involves pain lasting over 30 minutes that doesn't ease with rest. This is a life or death point to remember. Finally, the accompanying symptoms like cold sweats, nausea, and shortness of breath that appear with chest pain. These signs require particular attention. Please use the knowledge you've learned today to protect your own life and the lives of your loved ones.